RightPatient brings you another installment of our Inside a RightPatient deployment series covering the deployment of our Smart Health platform at Martin Health Systems based in Stuart, Florida. Martin Health chose to deploy RightPatient, the industry's most advanced biometric patient identification, patient engagement, personalized healthcare, and healthcare intelligence platform. Martin Health's first priority for implementing a biometric patient identification solution was to increase patient safety. We spoke with Martin Health staff to learn more about why patient safety was an important priority.
When it came to patient safety, that's sort of the no-brainer, right? Because you certainly don't want to have the wrong patient come up and you register the wrong patient, you give the wrong meds, you give something somebody's allergic to. So identifying the correct patient, and we have been, over the 22 years I've been here, we've been down several roads. We gave patients certain ID cards that, we said, bring this ID card and we'll never mix you up. We've tried a lot of different methods, but making sure and identifying that you've got the patient that they say they are is just critical, in places like the emergency room where things are going very rapidly.
The second priority for Martin Health was to deploy a non-contact biometric patient identification system that supported hospital infection control.
We had seen some presentations about some various technology, but when we saw it in place, one thing that we didn't like about it was the contamination factor, the factor that you did have to touch, that people were wiping it, some people didn't want to touch it. The registrars would have to wipe it clean. It seemed like it was the right idea, but maybe that there would be something better.
I can tell you that absolutely we are very glad that RightPatient does not touch the patient at all. So with the camera, the only associates go ahead and touch the camera. It never touches the patient. It doesn't even come close to the patient because it's still 12 inches away. So with that being said, infection control was put to rest because we didn't have to go ahead and wipe everything down and worry about germs coming here or going there.
Martin Health also sought to implement a biometric patient identification solution that would help to prevent duplicate medical records.
So the patient safety factor has affected medical records over the years to the point where we were spending a lot of money with merging duplicate medical records, 1 or 2 FTEs that would merge those records. The fact that now we can identify patient with the iris scanner, once we get the database built up, we won't have those duplicates anymore. And so that it of course, saves some labor. It's a much more efficient system that way, but it improves the safety. Clearly, any kind of absolute patient identification is just so critical with when it comes to patient safety, and we certainly take it seriously. And because we are a multi-hospital system, patients travel among our hospitals, and so it's not uncommon that we might not be familiar with a patient because they might go to our south location a couple times and then they're on the highway, so they go to the tradition location, or they decide that they're downtown and they're going to come to the downtown location. So there are a lot of reasons in terms of patient safety that we factored in to help supporting the reason that we needed to spend this kind of money on this technology.
Patient acceptance of the RightPatient solution was another critical priority for Martin Health staff.
When we explain to patients that it's for their safety, so that we can't mix up their medical records, so that we do have their correct clinical history, that it has nothing to do with finance or any of those other scary things, they're very accepting of it.
The acceptance to the patient is all in the approach that the associate gives them. So they have scripting that they can go ahead and say to the patient. Our information is never shared. It's only kept here in our vault on a separate server. So that stays here for patient medical identity theft, for patient safety features, and duplicate medical records. This is the safest way that we've seen it for the patient, and they seem to like that.
I believe that I have seen very few opt out. I think scripting is extremely important, and knowledge. We are a society of technologically savvy people, and once you explain to them and they have an understanding, they're more receptive.
To recap, Martin Health was able to deploy RightPatient with a non-contact iris recognition camera that supported hospital infection control and performs a complete search during each biometric enrollment to ensure that once a patient is enrolled, it is impossible to create a duplicate medical record for that patient. RightPatient will help to increase patient data integrity, and Martin Health was pleased with the easy-to-understand hands-on training for staff on how to use the system. Please contact us to learn more about how RightPatient can benefit you.